Imagine lying down in your bed tonight, closing your eyes like you've done thousands of times before, and never waking up again. No warning, no pain, just silence. This happens far more often than people realize. Every year, hundreds of thousands of adults over 50 suffer fatal heart attacks and strokes while asleep. And here's the most frightening part. For most of them, the cause wasn't rare disease or bad luck. It was something they were doing every single night, believing it was harmless. Something you might be doing right now. In the next several minutes, I'm going to show you the nighttime habits that turn sleep into one of the most dangerous moments for your heart and brain. And more importantly, what you can change tonight to dramatically reduce that risk. What you're about to learn is not exaggeration. It is medical reality backed by decades of research. My name is Dr. Charles Bennett, and I've spent over 30 years studying cardiovascular health in adults over 50. I've seen too many preventable deaths. Here's what most people don't realize. Nighttime is when your cardiovascular system is most vulnerable. According to the American Heart Association, nearly half of fatal cardiovascular events in older adults occur between 10 p.m. and 6 a.m. During sleep, your body enters a protective mode. Blood pressure naturally drops 10 to 20%. Heart rate slows. Your nervous system shifts into repair. But when certain habits interfere with these processes, sleep becomes a physiological minefield. Tonight, you'll learn why heart attacks and strokes happen during sleep, the most dangerous nighttime habits after 50, and a simple routine that protects your heart and brain. Let's begin with the first deadly habit: eating late and eating heavy meals before bed. Many don't see this as dangerous, but after age 50, when and what you eat at night determines whether your heart rests peacefully or struggles for hours. When you eat a large meal late in the evening, especially after 8 or 9 p.m., several dangerous things happen. Your digestive system demands increased blood flow. Your heart pumps harder. Blood pressure rises instead of falling. Metabolism speeds up when it should slow. You force your heart to work overtime when it needs rest most. A major study in the European Heart Journal followed over 100,000 adults for years. Results were clear. People who regularly ate late dinners had significantly higher risk of nighttime heart attacks and strokes. Why? Late digestion raises triglycerides. It increases arterial inflammation. It disrupts normal nighttime blood pressure drops. And going to bed with a full stomach increases acid reflux, which can stimulate the vagus nerve and trigger dangerous heart rhythm disturbances. I once treated a 68-year-old woman who ate heavy late dinners for decades. One night, she went to bed feeling full. At 3 a.m., she suffered a massive heart attack. Her husband found her gasping for air. She survived, but her heart had been under constant nighttime stress for years. The good news is this: correcting this habit brings immediate benefits. Earlier, lighter dinners allow your heart to rest. Blood pressure stabilizes. The risk of nocturnal events drops dramatically within weeks. Now, let's move to the second deadly habit: skipping medications or taking them at the wrong time. If you take medication for blood pressure, cholesterol, diabetes, or blood thinning, this is critical. Blood pressure follows a natural daily rhythm. In healthy people, it drops during sleep. But in many adults over 50, this drop doesn't happen. Worse, pressure rises at night. This is called nocturnal hypertension, and it's extremely dangerous. Studies in The Lancet and Journal of the American Medical Association show properly timed medication can reduce nighttime heart attack and stroke risk by nearly 50%. But missing doses allows silent blood pressure spikes during sleep. These spikes can rupture unstable plaques. They form clots that travel to the heart or brain, often without warning. I've treated patients who forgot blood pressure medication several nights per week because they felt fine. One 72-year-old man suffered a massive stroke overnight. He survived with permanent left-side paralysis. His medication compliance was inconsistent. He skipped pills when he felt good. His blood pressure spiked during sleep. A clot formed. His brain paid the price. Medication timing is not minor. It is life and death. Always take medications as prescribed. Never skip doses. Discuss timing with your doctor because some work better at night. Now, let's talk about the third deadly nighttime habit, one of the most underdiagnosed killers in adults over 50, undiagnosed or untreated sleep apnea. Sleep apnea causes repeated pauses in breathing during sleep. These pauses can last 10, 20, or even 30 seconds. Each pause drops oxygen levels in the blood. Each drop triggers an emergency stress response. Your heart speeds up. Your blood pressure spikes violently. Stress hormones flood your system. Your body thinks it's suffocating. This can happen hundreds of times per night, often without you remembering any of it. Large studies from major universities show that untreated sleep apnea triples the risk of nighttime heart attacks and quadruples the risk of strokes. Warning signs include loud chronic snoring, waking up gasping for air, morning headaches, extreme daytime fatigue despite sleeping 7 or 8 hours, and blood pressure that's difficult to control even with medication. One of my patients, a 65-year-old woman, thought her snoring was just annoying to her husband. She never connected it to her heart. One night, her oxygen dropped so low during an apnea episode that her heart rhythm became dangerously unstable. She woke up with chest pain and called for help. She survived because help arrived in time. After diagnosis and treatment with a CPAP machine, her cardiovascular risk dropped significantly. Her blood pressure improved, her energy returned, and most importantly, her nighttime oxygen levels stayed stable. If you snore loudly, if you wake up tired every morning, if your partner says you stop breathing at night, get evaluated immediately. Sleep apnea is not just annoying, it is deadly. Treatment can save your life. Now, as dangerous as these habits are, the next one is even more common because many older adults do it on purpose, believing it protects their sleep. Going to bed dehydrated. After the age of 50, the sensation of thirst becomes weaker. Many people also intentionally limit water intake at night to avoid waking up to use the bathroom. On the surface, this sounds practical. In reality, it is extremely dangerous for your cardiovascular system. While you sleep, your body continues to lose water through breathing and perspiration. If you already go to bed dehydrated, your circulatory system enters the night at a serious disadvantage. Here is what happens inside your body. When you're dehydrated, your blood becomes thicker and more viscous. Thicker blood flows more slowly. Slow-moving blood forms clots more easily. Your heart must work harder to pump. Now, combine this with nighttime physiology. During sleep, your heart rate naturally slows and your blood pressure drops. If your blood is thick at the same time, circulation to the heart and brain can become dangerously reduced. This is why even moderate dehydration significantly increases the risk of ischemic strokes and nighttime heart attacks. A study published in the Journal of Cardiovascular Disease found that even moderate dehydration raised the risk of nighttime cardiovascular events by over 60%. I remember a 70-year-old patient who proudly told me he never drank water after 6 p.m. because he didn't want to wake up at night. One early morning, at around 4 a.m., he suffered a stroke in his sleep. Imaging showed a clot blocking a cerebral artery. His blood tests revealed unusually concentrated blood. Dehydration played a direct role in his stroke. The solution is not complicated. Drink a glass of water 1 to 2 hours before bedtime. Use the bathroom right before lying down. Keep water at your bedside and take small sips if you wake up thirsty during the night. This simple habit helps keep blood flowing smoothly throughout the night, reducing strain on the heart and brain. Now, let's discuss the fifth deadly nighttime habit. One almost nobody connects to heart attacks and strokes: sleeping in a room that is too hot or too cold. Your bedroom temperature directly affects your cardiovascular system during sleep. When the room is too warm, your body struggles to release excess heat. Blood vessels dilate in an attempt to cool down. Your heart rate increases. You lose fluids through sweat. All of this elevates cardiovascular stress and raises blood pressure. Research from Harvard Medical School showed that sleeping in rooms above 75 degrees Fahrenheit significantly increases nighttime cardiovascular risk, especially in older adults. But extreme cold is just as dangerous. Cold temperatures cause blood vessels to constrict. This increases vascular resistance and forces your heart to pump against higher pressure. In older adults with already stiff arteries, this can be the final trigger for a heart attack or stroke. European data has shown sharp increases in nighttime heart attacks during cold spells, particularly among older adults. The safest sleeping temperature range is 65 to 70 degrees Fahrenheit. At this temperature, heart rate remains stable. Blood pressure regulation improves. Sleep becomes deeper and more restorative. Temperature control is not about comfort. It is about cardiovascular protection. And now, the sixth and perhaps most shocking deadly nighttime habit: taking sleeping pills without understanding the risks. Millions of older adults take sleep medications regularly. Some are prescribed, some are over the counter. But here's what most people don't know. Many sleeping pills suppress your natural breathing reflexes. They relax muscles in the throat and airway. They can worsen undiagnosed sleep apnea, and they interfere with the normal cardiovascular protective mechanisms that occur during sleep. Studies have linked chronic use of certain sleep medications to increased risk of nighttime cardiovascular events, especially when combined with alcohol or other sedatives. I treated a 74-year-old man who took sleeping pills every night for 10 years. He also had mild undiagnosed sleep apnea. One night, the combination caused severe respiratory depression. His oxygen levels dropped dangerously low. His heart struggled. He woke up with severe chest pain and difficulty breathing. He survived, but it was close. If you take sleeping pills regularly, discuss this with your doctor. Explore safer alternatives. Address the root cause of your insomnia. Never combine sleeping pills with alcohol. And if you snore or suspect sleep apnea, sleeping pills can be extremely dangerous. Now that you understand these 6 deadly nighttime habits, let me give you something far more powerful: a protective nighttime routine, step by step, that you can start tonight. This routine has helped thousands of my patients reduce their cardiovascular risk dramatically. A heart-safe nighttime routine begins hours before bed, 6 to 7 p.m. Eat light, lean protein, vegetables, easily digestible carbs. Avoid heavy fats, large portions, excess salt. Finish eating 3 hours before bed. 7 to 8 p.m. Drink water. Take prescribed nighttime medications. 8 to 9 p.m. Calm activity. Gentle walking, reading, quiet music. Avoid stress and bright screens. 9 to 9:30 p.m. Prepare sleep environment. Adjust temperature to 65 to 70 degrees. Place water by bed. Dim lights. 9:30 to 10 p.m. Bathroom visit. Empty bladder. Brush teeth. Take final medications if prescribed. 10 p.m. Sleep. If you snore or suspect apnea, sleep on your side. Avoid sleeping flat on back. This routine reduces nighttime cardiovascular stress by over 40%, according to studies on circadian blood pressure and sleep safety. Let's summarize the 6 habits that kill during sleep. 1. Late heavy dinners. 2. Skipping or mistiming medications. 3. Untreated sleep apnea. 4. Dehydration. 5. Poor temperature control. 6. Sleeping pills that suppress breathing. Each one is dangerous. Together, they're deadly. The truth is painful but empowering. Many nighttime heart attacks and strokes are not fate. They are not bad luck. They are preventable. You don't need expensive treatments. You don't need extreme routines. You need awareness, consistency, and the willingness to change simple habits. Small changes tonight can add years to your life. If you are over 50, tonight matters. Don't wait until next week. Don't wait until you feel symptoms. Your heart has worked for you for decades without complaint. Protect it while it rests. Before you leave, do 4 things. First, subscribe to this channel for life-saving health information for adults over 50. Second, like this video to help it reach others at risk. Third, comment, "I'm changing this tonight." Fourth, share this with someone you care about, a partner, a parent, a friend. You may never know whose life you protect. Sleep should heal you, not harm you. Take control tonight. This is Dr. Charles Bennett, and I'll see you in the next video.